Hi, Stephen and Dindy. It's up there for you. We're doing the physical assessment on Miss Tina Jones. Now, we've already done our introductions. Miss Tina Jones is a 28-year-old African-American female who's pleasant, keeping eye contact during the exam. Her chief complaint is she's requesting to have a complete health assessment for pre-employment physical. She's given us information freely without any problems. First of all, we're going to start off with the vitals. As you can see, her vitals are 128/82, heart rate of 78, respiratory rate of 15, temperature 37.2, with a 99 SPO on room air. Everything is perfectly fine and normal, within normal limits. Next, we're going to inspect her head, checking for anything that is out of the ordinary, any bald patches, any bruising, dents, scars, anything like that, any lice, anything else that we'd be checking for. Everything looks good there. We're going to use a pen light. We're going to check her eyes, see if they're furling. I'm going to check her eyes here, her right eye. Everything looks good. Check her left eye. Good response. Eyes are perla. No problems there. Next thing we'll do is we'll go ahead and inspect the mouth and the throat. Tongue looks good. No leukoplakia or anything like that. Her tonsils look within normal limits. Uvula is midline. Tongue is midline. No redness or irritation in the back of the throat. We're going to go ahead and depress the tongue. Everything looks good. No abnormalities. Take a look at the tongue underneath. Everything underneath in the frenum looks good. Pushing to the left and pushing to the right. Both sides of the tongue look good, no problems. Everything looks good and healthy and pink. We'll test for gag reflex. Yep. Miss Tina has a gag reflex, which means that she'll be able to protect her airway. We'll go ahead and palpate the cervical nodes. Make sure everything's good and normal here. And feel it for any abnormalities or swelling, any nodules. Everything looks good there. Go ahead and check the cervical. No palpable nodes noted. Excellent. She's doing great. We're going to palpate for the thyroid, just to make sure there's no abnormalities, no overgrowth in the thyroid. Everything looks good there. Smooth, no nodules, and no goiter present. We'll continue on down the way. We're going to go ahead and assess for orientation. There's her name and her date of birth. She knows where she's at. She's got the correct date. She's alert and oriented ×3. No problems there. We'll continue on. We'll check her ears and her sinuses. Looking at the right nares and the left nares, everything looks good and pink. No redness, inflammation. Everything looks good there. We'll check the right ear. Good pearl gray. Tympanic membrane. The conal light is at the 5 o'clock. We'll go ahead and check the left ear. Everything looks good here. All nice and clean and healthy. Gray pearl. The conal light is at the 7 o'clock. This is exactly where we'd expect it. We'll continue on. Go down into the anterior chest. Osculate the auscultate the cardiac points. So we'll listen for everything sounds good there. Let me turn this up a little so I can hear it. Perfect. Move on. Cardiac sounds good. Then listen to the anterior chest. Sounding good. Sounding good in all lobes. Anteriorly, we are clear in all lobes. Go ahead and use the spirometer because she does have a history of asthma. Spirometer findings are normal. She's healthy there. Go into the posterior chest. So the posterior chest, everything looks good and normal. No abnormalities, just some minor scarring, stretch marks. Nothing to worry about there. Also take the posterior chest. We'll listen. Everything sounds good there. We'll go ahead and go into the abdomen, inspect the abdomen. Everything looks good and normal here. Nice. All around, no, doesn't look like any distension. So we're going to palpate the abdomen. So we'll go ahead and go back and auscultate the abdomen first. All different quadrants. And we'll go ahead and palpate the abdomen light. No masses, non-tender. You just notice she does have some extra growth of hair in the abdomen area. We'll do a deep palpation here just to make sure there's nothing going on. No pain, no masses. Noted. Everything looks good there. Palpate the organs. Liver is palpable 1 centimeter below the right costal margin. Spleen is not palpable, which is good. That means you don't have an inflammation in the spleen. No palpable masses in the left or the right kidneys. So far looking good. Percussive liver span. Listen for the difference in the change in the tympani. 7 centimeters MCL on percussion. All normal. Then we'll go down to the upper extremities. We'll palpate the PMI, make sure there's nothing out of the ordinary. She's not obtunded or any large masses or anything shifting in any direction. We shift her over to her left side so we can check for any movement that would cause pressure on the heart. PMI is non-displaced, no heaves and no lifts. And we'll assess the range and motion of the neck. That's good there. No pain upon movement. Full range of motion in all areas of the neck. And assess for capillary refill in the fingers. Nails do not look split, cracked, or no ridges noticed. Capillary refill is less than 3 seconds. Good blood return. Go ahead and go to the lower extremities. I'll inspect the legs for edema. No edema noted. Looks good. Go ahead and assess capillary refill on the toes. Capillary refill is less than 3 seconds. Got a healthy blood flow down to the feet, which is good considering this patient has a history of diabetes. Toenails and everything are intact, no ridges. We'll go ahead and do the deep tendon reflexes in the lower extremities. And check the knees, the right. Perfect. Test the right knee, 2+, which is normal. And check the right Achilles flex, 2+, which is normal. Check the left Achilles flex. Again, it's 2+ and normal. And we'll go ahead and check the left patellar reflex. All within normal. Now we'll go ahead and assess the range of motion at the hips. Looks good there. Full range of motion. Again, full range of motion at the hips and the extensors. Flexor. Everything looks good on the flexor. Full range of motion. Normalities noted. Everything looks good for this patient. That is the end of our exam. Thank you.